Morning. Before I begin my remarks, I have something very special to share with you this morning. I am a proud member of the Walking Gallery, and I want to share my story as captured by the wonderful Regina Holiday on the back of my suit jacket. So I'm going to take a moment and spin around so you guys can see this. This will give you some context into the remarks I'm about to make. As I was silencing my BlackBerry this morning, I was just thinking about how far technology has come in the past 16 years. Think back to the mid-1990s. We used to go to retail stores. Now we go to Amazon. We used to have cell phones. Now we have smartphones. We have willingly given up books for e-readers. And we have social media. Technology has evolved, and we have evolved with it. But there's been no such technological revolution for the family caregiver. And I'm acutely aware of 1996, because that's the year I was thrust into this role. 44 million Americans need your help. They are providing care to someone who is ill, disabled, or aged. These unsung heroes are right here among you. Family caregivers live among us everywhere in plain sight. Maybe you or someone sitting next to you are like these family caregivers. My cousin Heather and friends Regina and Stan have cared for family members with cancer. My friends Mark and Adele each care for an autistic child. Karen was a longtime caregiver for her daughter who had a rare disease. My friends Phil and Linda, Ron and Dee have all cared for a parent with Alzheimer's disease. Sarah cared for both her father and her husband with Alzheimer's at the same time. Me and my husband Ben. We have 3 out of our 4 parents diagnosed with some form of dementia. In addition to other chronic conditions, we've been on the front lines for 16 years. Let's pause for a moment and think about who you know that's a family caregiver. Each one of them is part of the new normal. The family caregiver in the middle of the caregiving sandwich, often caring for their own children plus a parent or spouse with a life-threatening illness or chronic condition, and holding down a job. My professional career started in software development. The software development life cycle is permanently etched in my brain. It is often represented something like this. Many of you are app developers and can relate to this. At each phase of the life cycle, we need different information and tools to complete our work. The life cycle concept also applies to caregiving. Family caregivers need information specific to the phase of caregiving they're in. For example, a caregiver may be dealing with a crisis, assisting a family member with a care transition, or in maintenance mode, just trying to navigate day-to-day challenges. I've developed a visual representation of this concept. We may find ourselves in each phase many times over the course of our caregiving experience. In addition, our information needs fall into 2 distinct categories: gathering information to act upon, and providing information to others. I'll highlight these as we go along. A crisis refers to an accident, injury, or new diagnosis. During a crisis, caregivers may need to provide information to healthcare professionals, such as the patient's allergies and health history, family health history, immunizations, test results, and health insurance information. Also during a crisis, caregivers need to gather information like diagnosis or injury details, disease-specific information, care options, and next steps in the recovery process. Care transition refers to a new care setting or new phase of recovery or illness. During care transition, caregivers also need to gather information about the patient's care plan, for instance. Okay, ideally the caregiver would have been playing an active role in the development of that plan. Housing and caregiving options like rehab and home health, community resources such as Meals on Wheels and transportation, how to perform caregiving activities, and medical equipment that might be needed. And finally, maintenance. This refers to a chronic condition or permanent disability. During the maintenance phase, caregivers are also busy gathering information about long-term care supports, financial options, assistive devices, medication regimens, respite care and support groups. The family caregiver ultimately becomes the patient's care and services coordinator and frequently has important information to share with providers. Last year at this time, my 82-year-old mother fell and crushed her right arm. We pursued her admission to an inpatient rehab facility so that she could relearn how to complete her activities of daily living without the use of her dominant arm and hand. When they decided to discharge her, nobody bothered to ask about her living situation, her resources, or who would be caring for her moving forward. These are critical details. They eventually handed us 2 sheets of paper with 53 home health agencies listed. We had less than 24 hours on a weekend to figure out who to choose. My life would have been so much easier if I'd had an app that would show me the top 5 home health agencies in my mom's area and community services and supports that she might need. We do this everywhere else. Online, as evidenced by those retailers that are always telling me when I buy a shirt that I need these pants and scarf to go with it. Why can't we do this in healthcare? We all talk about public health crises such as obesity and diabetes. I believe that a large and growing public health crisis is the effect that family caregiving has on those providing care. Caregiving takes a huge toll on the physical and mental health of family caregivers, putting further stress on our healthcare system. Right now, too many family caregivers rely on informal and ad hoc streams of information from their own circle of friends, family, and colleagues, otherwise known as tribal knowledge. This is where you come in. You are in exactly the right place to help create a family caregiver ecosystem. You can lend your voice to help redefine primary care. Primary care is happening in the home. Caregivers must be key members of the patient's care team in all care settings. You can break down care coordination silos. We must align community supports and social services with healthcare. You can include the family caregiver in the conversation, educate them, train them, listen to them. You can rethink required patient data in your facilities. Record the family caregiver's name and their role in caring for the patient. You can help change attitudes. Make it everyone's responsibility to assist the family caregiver in coordinating both healthcare and support services. You can focus your innovation on the family caregiver. I'm here to tell you, my patience is growing a bit thin for arguments about privacy and security, arguments about who owns the data, arguments that the family caregiver is not a trained professional. We need to work together to figure out the intersection of mobile technology and family caregivers, and we need to make it work. There are 44 million people eagerly awaiting your help. Thank you.